Now we'll talk about bed mobility and the easiest way to get in and out of bed during pregnancy and the early postpartum period in order to put less strain through the abdominal wall. So first, I'll have you lay down on your side. In order to roll onto your back, I want you to take an inhale first. As you exhale, think about pulling your belly button towards your spine. Keep that tightness and exhale as you roll onto your back. Good. To get back off the bed, we're just going to reverse that. So I want you to think about that same inhale through the abdomen, exhale, brace the belly, and then think about turning onto your side. Next, to get off the bed, we're gonna use that breath again, but first kick the legs off the side of the table. Same thing, inhale to expand, exhale, contract that core, push through those arms to sit on up. Two things you wanna avoid doing during this movement are holding your breath and trying to sit up straight out of bed, because that can put a lot of strain on the abdominal wall. When using a stroller, there are a few things you should think about. The first is handlebar height. I want you to actually let go of the handlebar and hold your arms out so that your elbow's about 90 degrees of bend. Good. This is a good way to find where this bar should be. So I'll lift this up. All right, place those hands back on there. Next, you want to be close to your stroller handlebar as you're pushing. Good. So keep those elbows at a 90-degree bend. That's a good way to remember this. Don't forget that your partner may be a different height than you, so you may have to adjust this between uses.
There are a lot of changes that happen to the musculoskeletal system during pregnancy and labor and delivery. This is the pelvis. The pelvic floor muscles are a group of muscles that run along the bottom of the pelvis. They attach in the front to the bones here, and they attach on the back to the bottom of the spine. These are the muscles that can be injured during labor and delivery. During pregnancy, these muscles bear more weight and have more stress. During labor and delivery, these muscles have to stretch over 3 times their length in order for the baby to pass through. Another thing that happens during pregnancy is that the abdominal muscles separate in order to make room for the growing fetus. Sometimes in the postpartum period, these muscles don't come back together completely. This is called diastasis rectus abdominis. This is something that we can screen for during our evaluation and can be treated with exercises to help strengthen those muscles.